Hello friends, today I will discuss about anatomy of ear. Before starting my lecture, I would like to thank my Gurudev Shri Ashutosh Maharaji, founder and head of Divya Jyoti Jagati Sansthan. He is perfect master of the time and he bestows everyone with Brahmagyan, that is self-realization of God within, with the third eye or the divine eye. So, uh, I will in topic of anatomy of ear, I will discuss with you about middle ear first. What is actually middle ear? Our external ear, middle ear, and the inner ear. These are the three parts of our ear. External ear, it consists of pinna, external auditory canal, and middle ear, it's the part of ear that is present medial to the tympanic membrane. So actually middle ear is formed by different structures. In middle ear, we have a cuboidal structure. You can say a cuboid that has 6 walls, where we have roof, where we have floor, and where we have anterior and posterior wall, and medial and lateral wall. Suppose you are there sitting in a room. So the side, the direction where you are seeing, consider it to be medial wall. Consider the wall that's just opposite, that's behind you, consider it to be lateral wall. So then then we take it this way, that the wall that is lying behind me, behind you, is actually a tympanic membrane, and the wall that's facing the tympanic membrane or that is facing you is the medial wall that consists of promontory, or you can say basal turn of cochlea, and other important structures. And anterior wall, if we talk about anterior wall, it is formed by a thin plate of bone that separates it from carotid artery. And posterior wall, as we know, it is formed mostly by the mastoid. So now we will discuss in detail about middle ear. What is middle ear? Middle ear, together with adytus, antrum, Eustachian tube, is called middle ear cleft. It consists of different parts. So it can be divided as epitympanum, mesotympanum, hypotympanum, protympanum, and retrotympanum. Here, epitympanum, as the name suggests, epi, that means above. Epi here means that attic, or something that or area of tympanic cavity that is lying above the lateral process of Malleus, or that is lying parallel to the pars flaccida of ear, of tympanic membrane. And mesotympanum is the part of middle ear cavity that's lying opposite pars tensa. And hypotympanum is the part that's lying below hyper pars tensa. And protympanum, if we talk about protympanum, it's portion of middle ear that is present around tympanic orifice of Eustachian tube. Now we will discuss about the sides and the walls of the middle ear. Middle ear consists of roof, floor, anterior, posterior wall, and the medial and lateral wall. Starting with the roof, you can imagine yourself inside a tympanic cavity. Suppose you are standing inside a tympanic cavity with your back towards the tympanic membrane. So when the roof here is formed by the thin plate of bone or bone called tegmen that separates the tympanic cavity from brain from middle cranial fossa of our skull base. Floor. In floor, we have an important structure that is called jugular bulb. That is actually continuation of our internal jugular vein, and it further continues as sigmoid sinus. Now, in our anterior wall, we have a bone, thin plate of bone that separates the carotid artery from the tympanic cavity. It has two important structures, openings, we call opening for Eustachian tube and tensor tympani muscle. So, in our interior wall, the arrangement is such that the Eustachian tube opening lies inferior to the tympanic tensor tympani muscle opening. And next we will discuss about the posterior wall. Posterior wall, it is formed by the most of the mastoid. In mastoid, as you will understand with mastoid, it consists of mastoid air cells and the mastoid bone. And in posterior wall, we have pyramid. It's actually a bony projection that gives attachment to stapedius. Then we have structures like adytus and antrum. Here adytus is the opening that connects the attic of tympanic cavity with the antrum of mastoid. Then we have two more important structures we call as facial recess or posterior sinus. Facial recess or posterior sinus, as the name suggests, facial recess, it is bounded by chorda tympani, facial nerve, and fossa inclutis. Facial recess, it lies most laterally to the pyramid. And then we will discuss about the medial wall. Here we will that medial wall of the tympanic cavity, it is formed by the labyrinth. The first structure we see over the medial wall is promontory. It's actually formed by the basal turn of cochlea. Then we see oval window and round window. Oval window is superior to the promontory and round window is inferior to the promontory. Oval window is oval in shape and round window is round in shape. Oval window is covered by footplate of Stapes and round window is covered by a secondary tympanic membrane. So, one thing more I would like to add here, if we discuss about a hearing mechanism, when the sound is transferred from your external ear, from your pinna and external auditory canal to tympanic membrane and then to middle ear, here the phase difference that's present that makes the sound audible is due to the phase difference between the oval window and the round window. And one thing more I would like to tell you that there is one more important structure in middle ear, in the medial wall of middle ear, that is the facial nerve. Here we see two parts of facial nerve, horizontal part and the vertical part. That is covered by the fallopian canal. So when we talk about the facial nerve, the horizontal part, when it turns to vertical part, it takes a turn. That's actually second genu of facial nerve, and that second genu is present over the pyramid. And we will discuss here about some important relations of facial nerve. That's relations of facial nerve in medial wall of tympanic cavity. Facial nerve is present such that it is present above the oval window and below the lateral semicircular canal. To be more specific, I would like to tell you that second genu of facial nerve is between oval window and the lateral semicircular canal. And processus cochleariformis. Processus cochleariformis is that part from where facial nerve takes or forms first genu. As facial nerve enters the middle ear, it forms its first genu at the level of cochleariformis process, from where its horizontal part of facial nerve starts. Now, I would like to tell you some more important structures that we have in relation to processus cochleariformis. It lies just anterior to oval window and the and it gives attachment to tensor tympani, the muscle that affects the motion of Malleus. And one thing more I would like to tell you is this, that the tensor tympani muscle of Malleus is supplied by the third division of trigeminal nerve and stapedius is supplied by the facial nerve branch of facial nerve. Now we will discuss about sinus tympani. Sinus tympani is actually structure, or you can say sinus, that is present medial to the pyramid. It is bounded by ponticulus and subiculum. Now what we are left with here, as we know, is formed by tympanic membrane. But here in lateral wall we are having one more important structure. You know what it is? It is the scutum. It's the bony outer attic wall. So now we will discuss about the mastoid antrum. Mastoid antrum, or the posterior wall. Mastoid bone along with the mastoid cells forms the posterior wall of the tympanic cavity. Here antrum, it's the largest cell of the mastoid that is consistently present, and that mastoid ear cell is marked externally during drilling or during cortical mastodectomy or during canal wall down mastodectomy by McEwen's triangle or suprameatal triangle. Suprameatal triangle, McEwen's triangle, helps us identifying the mastoid antrum while cortical mastodectomy. Can you tell me how suprameatal triangle or McEwen's triangle is formed? McEwen's triangle is formed by three important structures. It is formed by the formed by the temporal line. It's a triangular structure where superior part is formed by the temporal line and the one arm is formed by the posterior superior part of the bony external auditory canal and the tangent to the middle of the posterior wall of external auditory canal. Now, if we discuss about mastoid ear cells, they are different types of mastoid ear cells, and in them mastoid antrum is the most consistent and mostly present. In mastoid ear cells, we are having different type of mastoid ear cells. Some are present around labyrinth, some are present around facial nerve, some around zygomatic bone, or zygomatic arch, and some of the cells are present at the tip. So, when we discussed about mastoid ear cells, mastoid can be of three types. It can be sclerotic, it can be pneumatized or cellular, or it can be diploidic. Sclerotic means there is no pneumatization or absence of mastoid cells or decreased mastoid cells. And in diploidic, we are having both sclerotic as well as pneumatic part. That means sclerosis and deficiency, there is decrease in mastoid ear cells with presence of some pneumatization. Now, you know one thing, when we do cortical mastodectomy or when we do canal wall up mastodectomy, in that we have a structure called corner septum. It's actually a perpendicular. It's actually a plate, or you can say a landmark that divides the petrous part of temporal bone from the squamous part. It's actually separating the petrous cells from the squamous cells. Now we will discuss about ossicles. We are having three ossicles there called as Malleus, Incus, and Stapes. In Malleus, we are having structures like head, neck, lateral process, anterior process, and handle, which we call membrane too. And next we are having Incus, that is having a short process, long process body, and then comes our Stapes. Stapes is the smallest of the three ossicles. It consists of head, neck, anterior posterior crura, and the footplate that's present over the oval window. And one thing more, we are having it present over the medial wall. Tympanic plexus is formed by the glossopharyngeal nerve, and it lies over promontory, and it's responsible for the sympathetic activity. And it's the sympathetic plexus that's present around carotid artery. And one thing more, when we talk about the anatomy of middle ear, we discuss one important thing about the type of epithelium that is present in middle ear. Here you will see anterior part of the middle ear cavity is formed by the columnar epithelium and posterior by the cuboidal epithelium. As we know that a nasal cavity or Eustachian tube is lined by the columnar epithelium. So actually the anterior tympanic cavity or middle ear cavity lined by columnar epithelium is continuation of the nasal epithelium only. So sometimes a question arises why there is decreased discharge or no discharge in squamosal disease or chronic suppurative otitis media with squamosal type. That's because of decreased secretion by the cuboidal epithelium that is lining the posterior wall of the tympanic cavity or middle ear cavity. Talking about blood supply, it is supplied by maxillary artery and posterior auricular artery, and lymphatic drainage is done by parotid, lymph nodes, and the retropharyngeal nodes. I hope you will learn about anatomy of middle ear, and my lecture will be helpful to you and fruitful to you. Thank you.